and I know this discussion is to encourage everyone to receive the vaccine, but I think I have a two-part question. So would there be any reasons for people to be denied of the vaccine? And do you need any health coverage to receive the vaccine?
I can jump in, and then my colleagues can jump in after. Um, uh, so I'll start with there are folks who were treated with two types of treatment if they had COVID-19. So if you were diagnosed with severe, if you were given infusion of monoclonal antibodies or plasmapheresis, or two types of treatments. They are recommending that you wait 90 days after your treatment to get vaccinated. Now, I know there were concerns about, hey, if I had allergic reactions to other vaccines, they really have this as a case-by-case basis to have a conversation about what it is. What they're doing is comparing what's in the solution compared to what was in the COVID vaccine, and my colleagues can speak to this about this. And they would watch people if you felt like there was a significant allergic reaction you've had in the past, but they weren't saying absolutely no, et cetera. So there are things and considerations on a case-by-case basis for people who might have had anaphylaxis, like, can't breathe, need epinephrine, et cetera. When you do go for the vaccination, they do ask you to sit down for about 15 minutes afterwards so they can monitor you, make sure that you're doing okay. So just if you have any reactions. And your second question again, Shankwada?
Do you need insurance, or you have
Oh,
to
yeah,
preferred in order to receive the vaccine?
you should not need insurance. I know that there are certain agencies or entities that will accept it if you have it, but that should not hinder you from getting it. I would, if there's a place that you're going, make sure you ask and see if that is an actual qualification. But all COVID related, I should say directly related COVID issues are paid for by the government. So you should be able to go to a place and show up and do it. Unfortunately, there may be some hindrances, and I'll say this from an equity perspective, where they're asking for insurance cards and IDs. That's another barrier to getting access to care. So, there are places where you don't need all that. You show up, you meet the qualification and the phase, depending on what phase you are for the state, and you get vaccinated. That's it. So, no, it should be free. I'm not saying entities aren't. I think some clinics or pharmacies are taking administration fee for that, but it should not be a cost share out of pocket cost for you. It should not. So you should know that. Okay.
Right. Piggyback, yes. Since I'm dealing with pharmacy, we do this every day. Essentially, it's free, period. If you have a Medicare card or insurance card, it's taken. If we can get an admin fee, it'll be billed. And we're very transparent about that too. Like, we'll just tell people that. At the end of the day, if you don't have it with you, nothing with you, you're getting the shot. It's free. It's covered. So definitely we'll be completely free for the remaining time, I'm sure, for a long time, until we get to that herd immunity. Back on the who shouldn't get it, there's one topic that's being brought up here lately, more so that I didn't hear at the beginning, but it's the pegulation part of the vaccine. If you've had a severe allergic reaction to any PEG product or pegulation product, you may caution and not get it. You may pre-medicate, you may be monitored, you may take it somewhere that isn't a big mass clinic. You might take it in the hospital or somewhere like that. Allergic reactions to PEG products are very rare. There's few products that people may know, bowel preps that have pegulation, and we've had some rare reactions to those. One of the more prominent reaction would be it's a cancer drug called doxorubicin. It has a pegulated liposomal shell on it, and some patients are pre-medicated in the hospital to get that for cancer therapies due to the pegulation part in that product. So that's kind of the only reason currently that you would kind of check up and say, I'm not doing this gym here. We might need to go somewhere else to give the vaccine. But really, there's hardly any true contraindications currently. That was mentioned. So.
Okay.
I would say, if I may, only one thing. Who pays for it? We already paid for it. It's taxpayers' money, right? Yeah. So go get our share, right? That's what it is. We already paid for it.
Yeah.
Thank you, Dr. Raj. I like that.
Policy point, Dr. Raj. I appreciate that policy point. Absolutely.
Yes, sir. Well, anyone can answer this. Dr. Delaney, being that you are administering the vaccines, I know one of the questions that has been brought up about my turn, basically. Now, we know that there has been vaccines distributed to first responders. Again, I was able to receive the vaccine because of that, and to our frontline workers. But can you speak to the timeline of when it would be for the general public to receive the vaccine?
It's a great question. It's the question I answer every single day. So I think I'm pretty prepared to answer this. Really, currently, it's kind of, this is the best way to lay it out. It's a math equation, okay? Currently, there are, in the phase that we're under, 443,000 people that are eligible to get the vaccine in our state, okay? Our state, as of last week, we were getting about 38,000 doses per week. Now, that's going to increase soon with the new Walmart 20% increase federal government agreement. But currently we're at 38,000 about a week, going all distributed across the state. In order to vaccinate that many people that are eligible, if everybody wanted it, of course, it would take 11.5 to 12 weeks just to get through the small portion of 1B that we're currently in. We're not even open to 1B fully. It's just 70 plus educators in childcare, and then any healthcare workers that have finally come around and said, you know, let's go ahead and go. I want to do it now, and we'll vaccinate those patients. And you know, it's kind of a frustrating thing, but I understand it completely. Is certain counties, depending on where you're at in the state, are ready to move, and some aren't. So currently, like, we're redistributing a vaccine that comes in each week to the pharmacy, because we are a 1A hub pharmacy. So we are getting, we have 2 super freezers, and we get Pfizer and Moderna. You know, each week it kind of varies on how much we get, but currently we're, you know, still vaccinating people we can locally, but we're redistributing a lot of vaccine out to, like, Mississippi County, Cross County, underserved areas that can get that just need more vaccine to get to those higher numbers of people vaccinated in the current phase. So again, back to the math. 11.5 to 12 weeks just to get through this phase. Now, if vaccine supply ramps up, that could speed the process up. So I'm hoping that 1B will open, you know, sometime, you know, fully 1B will open, you know, in March or April, you know, hopefully. That will, you know, that will certainly encompass a lot more individuals. I mean, you're looking at any essential workers, and if you look at the list, it's, you know, it's a long list. I mean, a lot of people will be able to get that vaccine at that point. People that have pre-existing conditions and that kind of thing will be added. The general public, whoever wants it, will probably still be early summer or so. But I would hope by the summer, we're able to vaccinate whoever, whenever we want to. Also, another factor in this will be other vaccine companies coming out with vaccines that will increase vaccine supply. And that will be definitely a topic to talk about, because I'm sure there'll be a lot of people that want to wait or not get that vaccine or get this vaccine. But I will encourage people, once we have multiple vaccines in the States, just outside these 2, to still get the first available vaccine that's to them. In order, I would never want somebody to wait, get COVID and die because they were wanting a different vaccine when this one was available. And it's because all the vaccines that are coming out are very effective at preventing severe COVID and, you know, death. Really, when you look at the numbers closely. So that's kind of where we're at right now with vaccine supply. But it's a week by week basis. So
awesome. Thank you all. And we have 3 minutes left. So I would like to just give this question to each of you in our wrap up. And again, we all appreciate you taking your time to join us. And so the last question that each of you can answer, what can individuals do now to protect themselves while they are waiting to receive the vaccine?
Well, I think we've seen all the campaigns, and I want to acknowledge that this pandemic has been exhausting. You know, not being able to connect with our friends and our loved ones and travel and go out freely and not trying to calculate. I remember when this whole thing came down, I was wiping down everything, you know? So the studies are saying you don't got to wipe down every single thing. High touch places, yeah, you know, keep that stuff clean. But I'm not wiping down my bananas anymore like I was in the beginning. But the things that help, actually, there was a new recommendation about even double masking, they're saying is really improving as well. Surgical mask, face mask, whatever, doing that also helps it. And I mean, that's exhausting. I get it. It's a lot, but that just proves that doing these simple things can prevent the transmission, especially as we are in this limbo waiting for everyone to get vaccinated. The safest thing to do is to do that. Put the mask on when you go out, social distance 6 feet, continue to practice good hygiene. I mean, if we just did that for the flu, the flu numbers went down too because our behaviors changed. I'm also, looking forward for our workplaces to look different now in the way that we engage in the space and the way that we work. I think the landscape is going to be different because they're thinking about how we can do things differently. We've proven that we can if you have that type of job to do that. So anyway, I say this to say that the same rules apply right now. Social distancing. The light is at the end of the tunnel, though. I really believe that. I'll also say a lot of these variants and mutations that we're seeing right now, we can slow that down by our behaviors as well, right? These things are mutating because the transmission is happening a lot. But if we can slow down some of that, if we just do the social distancing, put the mask on, etc. So I do have my eye out on these variants, so we're keeping a lookout on those things. But the best thing you can do in the meantime is do that. And obviously, when it's time to go, get vaccinated.
Absolutely. I couldn't agree more with everything that was just said. But these right here are what infects you, so definitely, no doubt, keep your distance, wear your mask, but wash your hands. Wash your hands. I remind people every day, it is respiratory droplet transmission. It is not airborne. So you have to touch it and then touch yourself. You have to put it on you, okay? Viruses do not crawl. They don't walk. They don't fly unless somebody coughs in your face. Hopefully nobody's doing that, but you have to infect yourself, So wash your hands frequently, wear a mask, change that mask out. Do not wear that mask all the time. That's, double mask when you can. That does help. It just puts more layers in between it. But I remind people that it's respiratory droplet transmission. So you have to infect yourself, essentially, or somebody has to walk up and do it to you. Now, if somebody's coughing, it can be aerosolized in a small room for a little while, and that's tough. But for the most part, when you're out in public, if you're washing your hands well, my hands are cracking. I'm sure everybody's are like that, and we spray down with alcohol all the time, so constantly. But back to the flu transmission, flu doesn't transmit as well as, it's not as virally fit as COVID is. It doesn't transmit like COVID does. We have dispensed one Tamiflu prescription all year. Amazing. I mean, Tamiflu runs out. We're the only pharmacy in town that has Tamiflu. We have hundreds of Tamiflu boxes that we don't know what to do with. And I was wondering if they're not testing, what's going on. So I called First Care the other day and was just talking to one of the nurses, and she said, "Oh no, we're testing every time we test for COVID. It's just no flu cases are here." And we've done a ton. We do a lot of point of care testing for COVID and flu, and I've done a lot of flu tests, not near as many as COVID tests, but I've done a lot of flu kit tests. Not had one positive. So there's no doubt that cleaning the doorknobs on gas stations and handles where high touch surfaces and washing those hands, they go a long, long way, and get that vaccine when it's available for you. Absolutely.
Can I just add one more thing, and just not specifically to this question? I was blown away by beside the fact that COVID is complex in and of itself, penetrating the knowledge of social networks that were inaccurate was deadly, not being able to. And so what I'm saying here is, if there was a project, an initiative on a community level, hold your educational boards accountable to teach children about public health and preventive services. I'm serious. The type of information that's coming out, that is circulating in social network, that is inaccurate, are killing folks. And we can teach people, if it's not in your school, in your social network, it is key. That is what I think is a big barrier as well. So those are things that we really got to start talking to our families and communities about.
Awesome. It seems like we're going to need a part 2 to this discussion. Again, thank you all so much for everything that was stated and being so transparent. And then too, for the daily work that you do to educate, administer, and to ensure that our community is vaccinated. At this time, I am going to turn it over to our program facilitator.